All right, can everybody hear me? All right, Brandy says yes. Brandy, you're back again, day 2. Oh, for some reason I'm not. Oh yeah, you're muted. Okay. Okay. Well, we will wait a few minutes for some other folks to jump on the line with us, and then we will get started. Okay, I am not yet seeing our chair, Laura Sheffield, who is with the Lexington Community Action, but we will go ahead and get started because I know you guys are here, and I appreciate you making time this morning to be a part of this conversation.
I think you're cutting in and out because I see mouth moving, but no words.
No words. Okay, one second. Check, check, check. Okay, how about now? Is that better? Was that you, Tabitha, that said I was cutting in and out? Okay, Brandy held up her thumb. If you can hear me, hold up your thumb. Give me a thumbs up. All right, folks can hear me. Excellent. Hopefully I'm not cutting out now. All right. Okay, so we have started our conversations about the new KHSA sections. And we had our first conversation yesterday with our family services group. And I thought that conversation went really well. Brandy was a part of that one. Brandy, would you say that went well?
Yes, very good information, very good communication.
It really was a good conversation. So hopefully our conversation today will be very similar. So what I want to do this morning, and we will just spend 1 hour, that really is my goal, is just an hour. So let me share my screen with you. So what I've got here, this is our health and nutrition section. And so you should have received a link to this, but if you haven't, I am going to copy it and put it into the chat for you, where you can immediately access this info. And so you might recall that when you were first invited to be a part of, or first asked to be a part of this group, that we asked you to take a quick survey, really identifying those top 2 to 3 issues that you think are facing children and families in terms of health and nutrition, and then what you thought were the top 2 to 3 challenges facing staff in terms of health and nutrition. And so we'll go over that in just a second, but here's sort of what I'd like to cover today. And so you see the link there for the materials. I'd like for us just to sort of review what the group is and what we're supposed to be doing. I'd like us to discuss all of those things that were identified by you. And then most importantly, I'd like us to sort of go through a conversation and settle on 2 to 3 major goals or projects that this particular group can focus on for the next 12 to 18 months in terms of how we're going about our work, what sort of training we might want to emphasize, and how we want to make a difference in terms of health and nutrition writ large. So with that, let me call up this particular piece right here. I'm not sure if I can zoom in or not, but I think folks can see it there, really the goal of this particular section. You know, the goal of all of our sections, we use the term section, but you really just have to think of it as a working group or a committee. I was trying to differentiate between sort of our standing committees, which do the business functions of the association, versus these very member-oriented policy and practice sort of groups. So we've sort of termed them sections. And so we have 6 of them, and you see them listed here. And this is the health and nutrition group. So obviously we're focused on the personal health and nutrition as part of a healthy lifestyle for students and families, talking about all the different benefits and programs that they may have access to. And so that really is what our emphasis here is. So with that, I might ask folks to, if I can stop sharing, to go around the room real quick and just introduce yourself, tell us where you're from and sort of what your Head Start experience has been. And I am just going to call on folks as I see them on the screen. So we're going to start at the top and go across. So Brandy, let's start with you.
Good morning, everyone. My name is Brandy Count Thomas. I'm with Grade Level Head Start and also work with Shine Early Learning. I'm the Director of Family Service and Health for the area. I've been in Head Start off and on for 20 years. So I really enjoy it.
All right, Heather Cheek.
I'm Heather Cheek. I'm with Bluegrass Community Action Partnership, and I am the Family Services and Health Specialist for Bluegrass Head Start. And I have been in this position and with Head Start for a little over 3 months now.
Okay, very good. Tia.
Good morning, I'm Tia Russell. I work with LKLP Head Start, and I've been with Head Start for about 11 or 12 years. And I've done different positions throughout the year. Right now, I'm the health specialist. I do health, family, nutrition, and mental health.
All right, Tabitha.
Hi, I'm Tabitha. I'm with Audubon Area Head Start. I'm the health service team manager. Been here about 5 years. I enjoy it.
Michelle.
I'm Michelle Cottle. I'm the Education and Health Manager at LKLP Head Start. I've been with Head Start for 17 years, working on and off from teacher all the way up to what I'm doing currently now. And then I was a parent prior to that.
All right, Ashley.
Hello. Hello, I'm Ashley Strunk. I'm the nutrition manager and local area manager at Lake Cumberland Head Start. And I've been here for 12 years.
Linda.
I'm Linda Burton. I'm with Gateway Head Start. I am the health and nutrition manager. I've been in this position for a year, but I've been with the program for 25.
All right, Amy Vaughn.
Hello, my name is Amy Vaughn, and I am with the Murray Head Start. I am the nutrition service manager. I'm also a dietitian, and I have been in this position full-time for 5 years now.
All right, Missy.
Hi, I'm Missy Ross. I'm the Health and Mental Health Manager for KCELC, and I've been in this position for 20 years.
Amy Hagan. Or maybe not, maybe she has her mute on. All right, Kim. Oh, and Kim just wrote into the chat her information. She's having trouble with her mute, but I think everybody can see there she's from Paducah. Okay, so that is our group today. So we've got 10 programs on the line for our first meeting just this morning. So one of the things, if you haven't looked at the folder yet, that has all our things in there, we actually do have the roster. And so you can jump in there and it's got all the contact information. So we've made sure to list who they're with and what their titles are, because as you're thinking about reaching out to your colleagues, we're beginning this process to actually use it to build our directory as well. So you'll be able to begin to see who some of your colleagues are there. As of today, we have appointments to our different sections from 17 of our 28 grantees. So we're continuing to get appointments to it. So this will continue to fill out as we get additional appointments from those that have not yet participated with us. So with that, why don't we turn our attention to the survey that was conducted. This was conducted, I want to say, over the last 2 to 3 weeks, and folks had an opportunity to sort of share their perspective on a few questions. And these questions are going to be used to help us as a group really decide what we think are those things we want to focus on. So this question was really focused on children and families. And so the question was, thinking about Head Start, health, and nutrition, what, in your opinion, are the top 3 issues facing children and families? And so we've got a few here. We'll just go down through here real quick. Dental care. I know that when I spoke to Laura Sheffield sort of about getting this group together and ready, that was one of her top issues as well. Availability of providers in specific areas, access to healthy food and affordable food, not meeting medical needs due to a fear of COVID, lack of education, immunizations, consistency of in-person instruction, obesity and health issues, lack of transportation, and again, you see cost of food is popping up again. Healthy weight, so we see that as the theme. Availability of basic needs is a theme. Food sensitivity, finding childcare to work, and then access to good health care. So I think everyone would agree that those issues certainly are health and nutrition issues that are impacting children and families. I want to see, though, from your all's perspective, are there other issues that you think are important to be included in our listing or in our thinking that really don't appear here? So I know not everyone was able, we only had 5 responses to this, so I know not everyone was able to participate, but are there additional issues that you as a group or you as individuals think ought to be included sort of in our thinking? So as we're thinking about issues facing children and families, and that's an open question to everyone. You guys want me to call that back up, or do you have it called up on your computers?
I think you've touched pretty much each issue that we see every day.
Okay, so if we had to sort of boil those down, if we're thinking about, so let me think about this a different way. What would you say are sort of the major baskets that we could put these issues in? So if we needed to categorize them, there would be health, sort of and in health, we would have maybe would there be a mental health line? Would there be a physical health line? Would there be an oral health line? Obesity. How are folks thinking about that? Brandy says we sort of caught the bulk of the issues here in terms of those affecting children and families. Are there any others? Or are there any here that sort of need a nuance? Okay, well, let's go to the next one and we'll come back to this. So let's go, let me find the right question here. Question 3. This was a question that was a little bit similar, but instead of thinking about children and families, we wanted to think about the challenges that you as staff are facing in terms of actually providing services around health and nutrition. So the question was, thinking about Head Start Health and Nutrition, what in your opinion are the top 3 challenges facing staff? So we've got importance of meeting health deadlines, stress due to COVID. And I think that is true, not just for the families you're dealing with, but certainly when it comes to burnout, when it comes to the stress that employees are feeling. We heard that a lot yesterday as well in terms of sort of a general family services conversation. Here's that issue of picky eaters popping up again. We saw that on the last one. I don't know if that means that staff are picky eaters, but there could be others that are. Multiple quarantine status of family members. COVID, obviously, that's an overarching theme that we see across all of these. Follow through from parents. I imagine that is an enormous challenge for many folks. You get them set up on a plan, you get them set up with their appointments, and all of a sudden there are no-shows, and what do you do? Difficulty with staff consistency. Again, recruitment and retention continue to be issues across all facets of Head Start. Keeping food at correct temperatures when feeding multiple classrooms, switching from in-person to virtual and virtual back to in-person, certainly. Parent participation, educating parents on their children's health, lack of consistency among healthcare providers, providing quality meals and meeting all the components and requirements, concern about getting infected with COVID, and the number of students with delayed development. So those were the issues that were identified by the 5 respondents here. Would you say, either as a group or individually, are there other issues that we aren't considering here? Are there other issues that ought to be included sort of in this list of things that are impacting our staff and their ability to deliver health and nutrition services? You know, for instance, yesterday, one of the issues that popped up in our family services conversation was sort of equity of pay, equity of staffing. When you're looking at different silos or different groups within the Head Start staff, whether it's education versus family services or education versus health and nutrition. Professional development was certainly an issue for the group yesterday. Training, integration, integrating family services better across Head Start as a whole. That may very well apply to the issues of health and nutrition as well.
That's true. You're getting the lack of staff now of people wanting to work. So you're having to wear multiple hats. So you're getting that mental health of people wanting to work, but that mental health of people having to work so many jobs to do that. So
yeah, and is that in the sense of you've got positions that you can't fill, therefore the people that you have are having to do more, and not only are they having to cover Jane's job, but now they're having to cover their own job, and now someone else quit, and now they're having to cover this next one, and it's just sort of a never-ending cycle.
yes, you're having to do that because you don't have people that want to work right now.
Right, and it's not just your frontline folks, it's working its way up through management as well, because managers are having to put on different hats to fill those holes. Because,
Correct.
you know, the buck stops with you, right? So
It's everywhere.
yeah.
Yes, I cannot agree with that more. That is exactly what is happening with our centers. And yes, it's overwhelming at times. Yes.
One of the points of conversation yesterday was the impact that a vaccine mandate may have on that in terms of exacerbating that challenge and problem. Do you see that when it comes to the provision of health and nutrition services as well?
Yes, yes, with us, that'll definitely affect us greatly.
Us as well, definitely.
I think it does a lot of people being afraid of what it's gonna do and their families and, you know, with everybody doing that as well. Cause the mask being with the children, you know, you've seen what it's dropped with wearing the mask in the centers. I could just only see what it's gonna do with the shots, what's it's gonna do, the change.
Yeah, there was some interesting information that Jeff Martin, who's the director of Audubon, was able to share yesterday. Basically, he was at the Region 4 Head Start Association conference and board of directors meeting last week or week before last, and they heard from several people within OHS Region 4 as well as folks in DC. And a lot of questions were asked about the vaccine mandates, about exceptions, about opt-outs, about, you know, how are they going to be enforcing it? How are school systems going to be looked at? Are they deemed to be contractors of Head Start? And how do you get that to happen? And thus far, the OHS folks, unfortunately, have not had any answers. And we know that guidance has not yet come down to really demonstrate how the programs need to be acting in terms of how's that going to be enforced, what's the formal deadline, you know, all of those things. So we do find ourselves just sort of sitting here and waiting. And we know that the longer that goes, the more myths and the more misinformation can be out there. Okay, so we've heard the burnout and wearing multiple hats, filling the gaps. We've got parenting issues here. We've got food issues here. Let's talk about, can we talk about the food and nutrition front for a moment? And because I think a lot of this has to do, a lot of the things that we've seen listed here and on the other side really had to do with health and mental health and parenting and follow through and maybe less on the food and nutrition. Are there any additional food and nutrition challenges that we think need to be exposed or listed here?
I don't know if anyone else is experiencing this, but we're having a hard time getting certain foods that we would normally order from our food source, Gordon Food Service. A lot of things that are no longer, or that they can't get. So they're sending replacements that are not the food that we would normally order and serve to our children.
Can you provide an example or two?
So one of the items would be those whole grain Cheez-Its that we use for snacks, and then they're sending some form of a cookie type snack, so a higher sugar type snack.
I'm sorry. I was going to say, I agree. We have Gordon's also, and we are finding that a lot of our items that we normally would order for snack, because we go with the CACFP food program, we're having to, they're either, it's not in stock or, and we're having to replace it with something else that will stay within the program. So we are definitely seeing that, and our schools are seeing that too.
Yes, same with us, like the schools, the things they're sending us, because we use CACFP also, and it doesn't fall under our compliance, but they're sending it from the schools and we have to use it because that's what they can get access to also. And we're also seeing a shortage across the board, even on items that we would use to serve the food, serving plates, all that type of stuff, cleaning supplies, everything.
We are having issues with delivery. Our food company is having a hard time keeping drivers. So our deliveries are being pushed out farther than we anticipated.
The same thing here. We have our school system. They actually sent out, one of the schools in one of our counties sent out a waiver from the company they order from for whole grains, they sent out a waiver. They've been substituting and purchasing other stuff as well, but being able to follow the CACFP guidelines, luckily we've been able to do that, but they sent out a waiver for the whole grains and for there was a milk component, but also our delivery drivers, like you guys were talking about, they're having trouble providing with the styrofoam for our trays, and they're saying that's hard for them to get, and the cleaners as well, like the bleach and the gloves. We're having to just randomly find just whoever we can get the gloves from, and the bathroom cleaners and stuff as well. We're having trouble with getting that purchased. So at least we have some stock, but that's, you know, that goes along with the cleaning and the food as well, being able to keep that up.
So what happens then when you're not able to figure out a way to make replacements that are satisfactory to the CACFP requirements? What sort of waivers or extensions or the sorts of things do you have there? Are folks running into that problem of having to figure out how to get around that, or just say, hey, we simply can't do it?
I'll be very curious to hear this because I would like to know, because I'm to that point, like you just said, where, hey, I don't know what else to do, you know, because this is what's given to us. And so, you know, we have food contracts, and so we still have to pay them for that food. And then if we turn around and have to spend more money to buy things that fall under those guidelines, it's just, yeah, it gets very overwhelming.
Has anybody run up against that yet in terms of actually having to say, or actually having to go through those steps? Amy, you may be the guinea pig.
Yeah, and I hate that because I don't want to say anything to my CACFP rep. It's new. This is the new fiscal year, so I'll just, you know, see how it goes for right now. But I do see that becoming an issue.
Yeah, the longer it goes and the more it continues.
Sure.
I was going to say, Amy, this is the other Amy on the call. Have you contacted your KDE CACFP rep to let them know that you're having these problems and ask them about what you can do and what waivers are available for you? Because I know at least last year, there were waivers that were available to us whenever food was in a shortage of some way. Because, you know, at that time, we were just trying to feed the children. So if it wasn't whole milk, but at least it was milk, it was going to be okay. So I don't know about you, but I would reach out to whoever your, I don't know, I say your rep, but whoever that is that you use or talk to with the program, and ask them what you need to do. Because I do that a lot too. Just kind of explain my situation and say, well, you know, what is this okay? Can we do this? And they're able to give me some guidance to kind of help in that situation. So I don't know if you've done that or not, but that might be a good place because they may be able to ease your mind a little bit about what you all are having to do with what waiver might be available to you.
Yes, I will do that. I'm going to give it a little time because I think I just overwhelmed them. I'm new to my position. I've only been here a year, and I started right when COVID hit. And one of the big things that I put on the surveys was the lack of training, and I've had very little training in my position. I'm going to go as far as to say I've had zero training. And so I feel like sometimes I overwhelm them at CACFP and different places, but because they had to help me through with the new application this year. But anyway, I will reach out to that, Amy. That is a good idea because I do remember last year there was that waiver, I know for sure, with whole grains. And I'll ask about that other stuff too.
So that raises a question, sort of takes us to a different topic. You mentioned training and professional development. So when we think about the needs of training and professional development across our folks in health and nutrition, what are we finding that is, what are we doing good and what are we lacking in? What are those areas or issues that you feel more training or more professional development would be warranted?
Okay, this is Amy Vaughn again. I think that, like, my position is the nutrition service coordinator, and that and just listening to what Amy Hagan was saying, it seems like we do similar things, but it may still have differences. You know, we don't fall under an umbrella of health specialists who do the you know, make sure everybody has their immunizations, and maybe some of the training that is very important in that area. But I feel like there's a category of us that really don't have a lot of training opportunities because we're almost specialized, if that makes any sense. You know, like this, I don't deal with my two health specialists, you know, they're doing other things today that I work with, but I deal mainly with the nutrition and the food program. And so I would say a majority of health trainings are focused more on, you know, the requirements for the program and getting health screenings and that kind of stuff, and maybe not as much for people that are doing the food program or dealing specifically with just nutrition. I don't know if that makes any sense or not, but you know, I just feel like sometimes, especially at the annual meeting, there's not a whole lot exactly for me in the position that I'm in, because it's a little bit more specialized. And I know some people have to wear both hats. Some people are both the nutrition and health service coordinators or whatever. But that's something that, I mean, would be nice, is to look at some of the more specialized jobs that people have to do in the programs, and have some kind of training or something like that for them too.
Amy, I agree with you 100%. Like, I did the annual training for the first time this year, and it was, I enjoyed it. There was a lot of information, but I'm like you, I am the nutrition and health manager, and it's hard when you're talking about different regions and it doesn't really apply to where you are, because we do things different. Like, for instance, I'm in a region where I've been told reach out to the region next to us, to their nutrition and health person. Well, they do things totally different. They prepare their meals at their center. All of their students are right there in that center. And so they don't food contract with schools. So see, like, even the paperwork that I do is totally different. So sometimes I just feel like I'm an island, you know, where I don't know who to reach out to get help. And then when you come into a job, the person that was here before me left 8 months before I did. And so there was no onboarding, no real significant training. And I feel like I'm always kind of behind the 8 ball trying to figure out how to do things. And yeah. And then to top that off, I'm the person that then is supposed to train my nutrition specialists under me who are serving the food to the children. So it just works its way down, you know what, it's just difficult. And especially, like I said, right now during this time, it's even, you know, more so.
Yeah, I mean, it would have been, perhaps it would have been beneficial for you if you had had somebody, and I know this was recommended to you because you reached out to the person in the other place, but they did it completely differently. But it's almost like you need if you're new to the position or rising into the position, you need some sort of a mentor or somebody that you could just readily call upon. Not necessarily in your office, not necessarily in your program, but somebody around the state who could sort of walk you through things and could sort of be your go-to person for questions.
Absolutely, because sometimes I'm even I don't want to use the word afraid, like I'm scared, but like sometimes I don't want to ask a question to certain things because I'm like, oh, they may think I should already know that. You know, it's just that kind of
Right.
difficulties.
So we talked a lot about the food and nutrition. We've talked about training and professional development, and even that has had a bit of an emphasis on food and nutrition. What about, let's switch gears for a second and go to health. Are there specific challenges or training issues that you think exist when it comes to health, generally speaking? And of course, that's a question for everybody. Or like you said, are there sort of plenty of things that are out there to select from, plenty of things that exist, or do you see some things that, if there was some training for that, I'd really like to have it?
We've noticed just some little things, and it kind of piggybacks off of what Amy said on the training thing. Just like on some of our paperwork, our documents that we have the families fill out for health, they're questioning the redundancy of it, and it's almost like, well, what do other organizations do? How are other organizations doing it? And if we would have the mentor, or almost like the committee or other people to bounce ideas off of, I think that would be very beneficial.
So when you talk about that, what would be a specific, could you walk me through an example of that?
Okay, for instance, our parental authorizations that we have the families fill out. So if we have a child, Johnny, for instance, and we're needing his physical, they have a release they have to sign so that we can get that sent to us. Now we're having each of the parent would sign one for each of the providers. So one for the medical, one for the dental, and if they have a vision. And it just seems like the buy-in with the staff and the families, they don't understand the importance of, we have to have one for each provider, because it's a HIPAA violation if we put multiple providers on the same form. Just like things like that. Or like Amy said, just like having a mentor of, I know when I came into this position, the person I replaced, I was happy that I had 4 years experience as a health specialist before I came in, because if I hadn't had that, I mean, it would be totally just blindsided and trying to, what exactly do I need to do? But we have different, like I guess each organization is set up differently. So I just handle the health. We have someone else that handles the nutrition, and she's not on here. And I was making notes of, we need to invite her to be on it next time. Then we have someone else that does the mental health component of it. And I guess it's just because our program's so large, we service like 2,500 children and families. So we have different people that jobs overlap, but it's structured differently in each organization.
Just for my own curiosity, so when you have the parents fill out a form like that and they have to sign 3 different forms for 3 different providers, do they have to do all of that in person on paper, or is that done electronically?
No, usually we do it at enrollment. Yeah, they do it at enrollment or orientation. They'll do it in person. Okay.
Yeah, it's almost like you need some sort of electronic thing where it goes through and you say, yes, this, yes, this, yes, this. Like when you go and, run a title for a house or print out.
Right.
You just fill in 1 or 2 items and it spits out the rest for you.
Yep. Or another problem we're facing is like with COVID, we have children that have immunizations that's coming due, and some of the providers, like if they're backlogged, they might push out that appointment. Well, we have to have up-to-date immunizations for the child to attend. So we're printing out provisionals for these kids. And I mean, it's okay to print out a provisional here and there, but you don't want to continue for 3 months straight printing out provisionals every 2 weeks. So it's just like, I guess, COVID issues again.
Right.
So Tabitha, that's new to me. So we're getting ready to have a meeting this afternoon about our policies and procedures. And there was something that came down that said that we had to have something in writing or be able to discuss, like if we were not able to meet those 90-day health work. And then I did not know. So there is a provision for immunization where the child can still come if they don't have the immunization.
It depends on the case. It's like a case by case basis, but yes, we have login acceptance or we're access rather to the Kentucky Immunization Registry.
Okay.
So we have certain staff that you have to apply for that, and then when you get that access, they can get on there and they can print off the children's immunizations, and you can print off like provisionals on there. But we've made a policy where they can only do that like twice, and then they have to reach out to their health specialist, and then case by case basis. Now, if it's something where maybe the family is considered homeless and obviously their priority is just housing, food, basic needs, then case by case we work with them. But that's what we're seeing.
So John, let me just say this, that is this right here, what's happening between Tabitha and I. I've never met her. I'm not even sure what county you're in, Tabitha, but or where you are, but this is exactly what I wish I had, or what is needed. This just complete, and I just like, this is what I have longed for since I started for a year, just to be able to reach out to people, say, hey, what do you do in this situation? How do you handle this?
Yep.
Yeah, this is amazing.
Yeah, just email me after the meeting, and I can get you the forms to fill out to send in to the Kentucky Immunization Registry.
I appreciate that. I will do that.
problem.
Thank you so much.
Perfect. We've already solved one problem right there.
Now there's just 500 more, but we'll
Yeah.
take it.
Yeah,
one by
five
one.
or 600 more.
One
than we got
down,
to
a million to
work
go.
Okay, so here, let me look at the chat real quick, see if there's anything.
Hey, John, can I ask one question? I
Yes,
have to
ma'am.
actually leave, and here I go, putting on another hat to go help with in the cafeteria here. So is this being recorded? So
It is.
Okay, so I can come back and watch this.
Yeah, so it's being recorded, and just so everybody knows, one of the things that I'll do after the call is I will write up the summary and try to distill down what it is we discussed, because I think we're getting pretty close to being able to determine a few items that we'd like to focus on, sort of right out of the gate. And that doesn't mean that we have to focus on them forever, but these are the things that maybe we want to sort of zero in on here at first, so that we do have sort of a path we're going down. I think one of the challenges that our committees had previously was it was really great for people to get together, whether it was in person or via Zoom, and have conversations, but there often wasn't anything that came of it other than, the conversation that Tabitha and Amy just had, which in and of itself is fantastic. And we need to be having more of those, but I'd really like us to have sort of that, more of that structured, these are a few of the things that this group is tackling, and then we're going to move on to other issues as we go down the road. It's a very organic process, but one that hopefully will keep us going. So yes, so it's being recorded, and I'll send out a summary, and we will try to get, once I send out that summary, we can make some decisions as to when we want to come together again. Right now, I'm sort of envisioning that these groups, each one of these sections would come together 4 to 5 times a year to be able to have these conversations. If you, however, find that you'd like to have the conversations more often, we can certainly do that too. So it's just up to each group to decide how they want to move forward. So long answer to your question, Amy.
That's fine. I just want to make sure in case anyone reached out to me while you were continuing and I don't answer that. I'm gonna leave it running, but I hopefully will be back, but just in case. Thank you so much for everything.
Yeah, and again, everybody, you've got a copy of the roster with emails right there in that folder.
Oh,
So
okay, great. Thank
be able to
you.
reach out to anybody who's on the in the group, and they may not be on the call, but they're in the group. Okay, so let's go to another question that we asked. And this question was, if you could wave a magic wand and immediately fix one issue or challenge related to Head Start health and nutrition, regardless of time, staffing, or cost, what would it be? So this is sort of that blank piece of paper where you get to fix anything. And so the responses that we got were to meet health event timelines for the children. And I think that may be related to some of the things we were just discussing. Someone could be hired and or on call to handle all COVID specific matters for children and staff. So rather than everybody having to be a jack of all trades and know what we're doing this week, you've got somebody who sort of serves in an overarching role. Proper training for staff, we've already hit on that quite a bit. To have all children in person receiving all services, yep. Getting more parents to work with their children before they even get to Head Start, yep. So those are the sort of the main issues that people identified that they'd really love to fix that could make their lives either as staff easier or better, or could really be impactful for the children and families that they serve. So all of that being said, we've got about 14 minutes left in our hour. And so let me go through and just sort of recap some of the things that we've discussed. We've talked about sort of broadly the issue of recruitment and retention. We talked about wearing multiple hats and burnout, sort of the need to keep filling in gaps in staffing. We recognize that the vaccine mandates might exacerbate this challenge. We talked about food access for programs, often a hard time getting food from providers. Certain items not available, replacements may not be at the same level or meet the same requirements of the food programs. Often having trouble getting different supplies, deliveries are slow. We've got the CACFP guidelines. Nobody's had to go up against that yet, but there may very well be some that are doing it soon. Training and professional development, recognizing that there's an awful lot of health-related training out there, but we need more nutrition and food-related training and specialized training. Let's see. Recognize that for new folks in these roles, we really need to figure out a way to have some mentors or other experienced people across the state available to them. And then Tabitha had raised the issue of sort of redundancies when it comes to a lot of the paperwork and permissions and forms and things that exist there. So that's what I've got so far. Are there other issues that we're sort of missing? Anything that in a perfect world you'd really like to tackle right out of the gate? I think what we had listed in sort of question 2 and question 3, the issues facing children and families and the issues facing staff, I think we're going to be able to come up with 2 to 3 items from that list that we could really focus on. So I just want to open it up and see, are there other thoughts that folks have or any real burning issue that you're afraid might get left by the side if you don't mention it?
John, I'm the health and the mental health manager, and I am finding that we are having a huge problem with behaviors already this year. And maybe some training on how to deal with these children and, exactly what our options are. It's just, they're so severe, and I'm having a really hard time getting my health component work done for being in the classroom all the time with these behavior children. So maybe something with that would be great.
Gotcha.
I was thinking maybe, with COVID right now too, we're getting a lot of obesity and overweight children. Maybe we can get some proper training on how to go about with talking to the parents in a way of not offending them or going overboard or stepping lines to the parents saying, why are you talking like that? Why are you bringing my children and saying this? So maybe some proper training or ways of coming about that to the families.
I agree with that. That's been kind of an issue with us. We have children that we do growth assessments on, like a second growth assessment if they're 95% and above or 5% and below, but it's almost like the staff are reluctant to reach out to the parents and communicate with them, with the chance of offending them if they misspoke on something. So yes, that would be very beneficial.
Yeah, those two would be really good pieces, and particularly on the behavioral issues for children, I could see that being a blend with our disabilities and mental health group. And they're going to be meeting this afternoon at 1 o'clock. So that'll be something that we can raise with them as well. What other issues or topics? Those last two are fantastic. Well, not fantastic issues, but fantastic issues for the group to address. Okay, so let's shift gears a minute. So Amy Hagan had shared sort of her challenge, and Tabitha was able to provide some resources and insights for her. Are there other challenges that people are facing sort of here and now today that they'd like some guidance on from the group? This is sort of that, 5 to 10 minute, good for the order, everybody sort of share any challenges, problems you're having that you'd like some advice on. So everybody's doing fantastic. Okay, so any other topics that you think that we have not yet listed in addition to the things that were in the survey and the things we've discussed today? And like I said, I'll go through and distill these down and send them out to you guys sort of in a way that outlines them as several different goals or objectives, and you all can react to them and say, well, yeah, that's good, but, or I think this one misses the mark, or that one's spot on. And then we can also then use that to determine when we'd like this group to come together again. Does that seem reasonable? Have you all found value in this conversation today? Well, I see a lot of head shaking. Yes, good. All right. So is there anything else folks would like to share? Okay, like I said, we have our disabilities and mental health group is meeting today at 1. And then I think tomorrow we have our data and technology group that's meeting. And then Friday we have our education group that's going to be meeting. And so hopefully by the end of this week and beginning of next week, we will begin to have a real feel for many of the topics and issues that each of these groups want to address. And I think it's important for everybody to see what all the other groups are doing too, because I think then you'll begin to see, oh, okay, mine might fit into that, or there could be a way that we could create a small little working group on something. Brandy, are you going to be with us at 1? Are you going to go 3 for 3?
No, just
Okay.
two. Give me for 2.
Okay, guys, I really appreciate you all making the time to be with us this morning. And I'm going to get this information out back to you, and you should see some messages from me, and we will go from there. So I really appreciate it. And I think this is the beginning of something really good that can service our programs and our kids. Thank you all. Have a great rest of your day.
Thank you. You too.
Thank you.